Hey everyone, Nick Jaworski here with a bunch of friends. As you can see, this is Trending Treatment News, and what we're going to do is a bi-weekly show talking about recent developments in the field or trending news that is happening. We're very excited to be sharing our perspectives with you. And so today we'll be talking about Shatterproof has some guidelines that came out last month, and they're actually starting to implement them this month in some test states. So we'll be diving on into kind of what outcomes mean for the field, why Shatterproof is taking this upon themselves, and maybe why not the field themselves having particular guidelines on their own. But first of all, obviously, I'd like to introduce myself and have everyone else introduce themselves. So I'm Nick Jaworski. I'm the owner of Circle Social Incorporated. A lot of people are familiar with me. I own a marketing and operations consulting firm based out of Indianapolis for the addiction treatment space. So I will be bringing more of a national perspective in terms of marketing and operations and how these trending treatment discussions affect the field overall from that perspective. James, if you want to introduce yourself.
Yeah, thank you. This is James Hadlock with Blue Novus. We are a admissions and marketing training company. We see ourselves as a human development company, really, but we help treatment facilities in better addressing admissions and marketing, more empathy, more compassion. And then something else that we are doing is we help corporations around the country in better addressing addiction in the workplace.
Very cool. Thanks, James. Kathy?
Hi, so I'm Kathy Frossard, and I'm with Foundations Recovery Network, which is the addictions arm of the UHS behavioral health systems. My background is a little diverse, but at the moment, the focus really is about the points of entry. So I work with business development, the admissions center, and the marketing team to look at how we can do the points of entry in a different way these days. So.
Very cool. Jacob?
Hey, I'm Jacob Lynch with Stone Ridge Partners. I lead our treatment center space here, and we focus exclusively on mergers and acquisitions in the behavioral health space, as well as some home health and hospice, but those are the only areas that we do. Kind of a boutique firm, lower middle market, been around about 20 years, and my past is largely finance and marketing, private equity, consulting, et cetera. But I'm excited to talk about today's topic. It's near and dear, and I think it's important. So have at it, Nick.
Very cool. All right, so everyone, like I said, we were talking about Shatterproof has guidelines coming out for treatment centers, and the goal of this is, if anyone knows Gary and the mission of Shatterproof, they want to make it so that there's a lot of transparency and a focus on evidence-based practices in particular. You know, Gary had a child that he lost to treatment, unfortunately, had a very negative experience there, and so he was upset that there wasn't necessarily evidence-based practices being used in all centers, or that there was ways for the community, parents and loved ones and individuals to evaluate treatment centers and find the best fit for them. So I think the first question is to kind of discuss is, why do we think that this organization, Shatterproof, is ending up taking the initiative on this rather than, you know, the treatment centers coming together on their own? And I'd like to maybe start with Kathy, since you've got a broader perspective, kind of being in the treatment center yourself, that's a wide reach. You know, where do you think this is coming from, or how do you think it fits into the overall conversation?
I really think just in our work with Shatterproof has been about our races, our 6K races that we were doing was our early work with them. But I think that real clear thing that stood out was that there's a lack of trust for the industry itself. And so I think they were trying to define some good guidelines and say, hey, how do we break that trust? Because at this point, it's not just a stigma for going to treatment. It's actually almost a stigma against our industry as to who do you reach out for treatment. And I think we're trying to break those walls down a little bit.
Yeah. Jacob, James, you guys want to chime in?
Yeah, I agree wholeheartedly. I mean, I think it's just a piece of being objective, right? I think you've got people that are going to obviously have an interest one way or the other if you let them govern their own or get their own results. Plus, you know, they're trying to run a business. It's probably pretty hard to track down all the data that they need at the same time. I think this might be a little bit more efficient as well. The part I read in that article that was a little concerned was later they said they're going to have a rating system, and then you get into the same issue that you do with any industry, where is someone, are there lobbyists like government? You know, is there someone paying or playing unfairly in order to get a better rating? So I think you're still going to run into some issues even in being a third party doing it, but at least it's a step, I think, in the right direction.
Yeah, and I would echo both of those comments in just sharing, if there is such a lack of trust in this industry, and I came from, I'm in recovery myself, and now being in the industry and understanding a little bit more about how things go. I mean, everything from what happened with Google AdWords and searchable keywords and just even patient brokering and all those negative pieces that have come into our industry. Having a third party, an unbiased third party, I think makes a lot of sense. I'm really curious to see how that will evolve, because there's probably going to be some unintended results that come from this that we'll need to address at that time. But I think just from a baseline perspective, this is a great way to really help and advocate for those who are struggling and loved ones that are searching for treatment.
It's interesting. I think there's a lot of value that comes from having a third party, as you guys are talking about. A curious point for me is, when I'm in treatment centers, in various states, I've always sensed a strong reluctance to talk about outcomes in general. There has been a lack of a desire to move forward with talking, and usually the number one response I get, like almost every single time, is, well, what do they mean by outcomes, right? How do we define results? Sure, that's a really important question, but why aren't we taking a leadership role in defining that and then tracking outcomes rather than just using it as an excuse not to do anything? So I feel like Shatterproof is stepping into a role here because there was a gap and a void that the treatment field wasn't necessarily willing to fill on its own. I don't know if anyone has comments on that.
We actually work with foundations. They have a great research group, and one of the things what we've discovered is when you share outcomes to an area that doesn't have defined outcomes, is that people question the outcomes. So it's very interesting to say that if we define our outcome as the extended time that you're in recovery, where someone else might define the outcome as when you leave treatment that you stayed the whole 30 days, if that was what you prescribed. I think that without that definition, we're kind of running into this risk where people have to assess it themselves. And I can give a good example, and that is recently I was talking with a woman about treatment centers, and she said, anytime I see like this big article that's like a big newspaper article or website page that's explaining how ethical or how good the treatment is, I trust it less. I thought that was a really interesting perspective from someone who's looking for treatment for someone.
One of the things that you said there, Kathy, is I think there has been this challenge. We have not even come to an agreement of what outcomes to track, and how do you even define success? And I go back into the real world of, I have very good friends who see themselves, they were addicted to heroin, that may have an occasional drink, but their life is completely different. They are happy, they're functional, they're excelling in life. Some people would look at that and go, well, that's not recovery. And then I know other people who haven't had a drink in 30 years that their life is an absolute wreck, and they're hanging on for dear life. And so I think one of the first things to address is, how do we even define the type of outcomes that are trackable? What does that look like? And so I'd love to hear all of your thoughts on that, because that's what kind of goes around in my head is, well, if we can't even agree on what to track, then how in the world are we going to even get any kind of outcome at all?
Yeah, I'd agree with you. That's the stuff I was going to say when Nick was speaking there. I think, and I'm no clinician, I'll be the first to admit that, but I mean, it's just kind of the same we do with politics or other things where we complain about things that don't come up with an actual solution or bring the problem without answers. So like Nick was saying, I think us using, well, we don't know what outcome measurements or results are or how accurate they could be. That might be true, but I don't think that's a reason to not pursue the point at all. So I don't know necessarily what should be tracked or how. I could probably think of some processes that might help us get more answers and data, but I'm no clinician. I'm not the one to speak to what should be tracked.
Yeah, I'm going to agree kind of with that sentiment, Jacob. I'm, as an entrepreneur, I like to execute. That's kind of what I do. I do stuff, I test it out, I see if it works. And so I think that's probably the right approach is, right, put some metrics in place and track them. And if they end up not being the most appropriate metrics, or we find out that there's better ones, well, then we adjust that as we go. But we have to start somewhere, right?
Yeah,
we have to
moving
put that
target.
into place. Yeah, exactly. And also, like, if you do run for office, I will vote for you, Jacob. So.
Well, you know, it's interesting, and I may have missed this completely, but when I looked at the 8 different points that Shatterproof was expressing, I didn't see any definitive tracking of outcomes. I saw more around processes, which I think goes back to this idea that do we, and I've got some ideas about that. I like to pull a lot from the other businesses and how they do things. And one of the things that I think could be really interesting, are you familiar with the Net Promoter Score? Do you know what that is?
Yep.
So if you, in the business world, there's this really simple, they've been able to distill how your company is trending by something that's called the Net Promoter Score. And I have been fascinated with this. And just briefly, what it is it's simply when you ask the question, how likely are you to refer that company to friends and colleagues? And if the score is not a 9 or a 10, you're trending down. So it's and I don't know all the science behind it. I'm not an expert at it, but as I look at that, I go, wow, what if we could distill at least, you know, they agree that it's not an exact science, but just understanding either a trending up or a trending down is vitally important. And in this industry, I think it would be really interesting to come up with something similar, or even use that in some aspect. I mean, could you imagine being able to interview somebody 6 months after they have been through your treatment facility and asking them, how likely are you to recommend this facility, right? So it's maybe a little bit of a different take on outcomes, but from a company standpoint, I think that would be, I mean, if I were to ask Kathy, how valuable would that be for you?
Oh, I think it'd be tremendous. That's the question that I think is often missing. And if you take a note out of the book from like healthcare, acute healthcare, they do HCAP scores to measure and to define a lot of how they should say you should go to a hospital. Those are all done on random thought patterns instead of on a consistent question that really is, what does this mean to your heart? And in this industry, if we don't hit that, we're not going to be really successful in helping someone else get into treatment.
Yeah. You know, that Net Promoter Score, we had a ton of experience with it in the financial services industry all the time, and it would be done or built by surveying clients, right? Well, in this industry,
yeah.
How often is the provider going to survey that client, right? That patient?
Well, and I look at that because I really have done some thinking around this, and one of the things that I would say is if a no response is a 0.
Right.
So yeah. Because what that tells you is they're not even engaged with me, and so I mean, it would be my guess is that we would have very low numbers when we started something like that, but over time you could say, but you know what, a 4.1 today and a 4.8 tomorrow would be terrific, right? At least we know that we're trending, and it to me, I think we try to complicate things a little too much, and the more we could simplify, I think applying that one little score into one's practice would at least give us a starting point, and it would at least say, hey, they're engaged, hey, they really enjoyed their experience, or they're not even showing up, which would tell you a lot too, right?
Yep.
It's really interesting, especially about the zeros. Hazelden actually does really good tracking, if anyone's familiar with it. They do a lot of patient outcome tracking, but they also throw out all the people that they weren't able to contact. So it's probably, leans towards the positive end because the people that are wanting to talk to.
The system.
A little bit, Yeah.
That's what everybody could do in their favor if you don't have a third party. However, at least doing something so when I got into this industry, been doing mergers and acquisitions, but not healthcare, right? And when I tried to learn everything I could, all the acronyms, all the ins and outs of treatment centers and so forth, I was just amazed in all the other places I've worked and all my career and ever read about or studied or anything. This healthcare is the only place that I've ever seen or that I can think of that does this fee for service. Like whether or not what you did worked or was successful or anything, we're going to pay you. And as long as the insurance is in charge of that, I mean, again, I'm no clinician, but I can tell you from business that's going to change. Like over time, we all know that this outcomes and results is what's going to drive this thing. They're not going to keep paying. So as this thing starts to track, as we start to build that, one of the main things I think the provider should keep in mind is that they're going to want to market their results and their outcomes and so forth to the insurer. Of course, you're going to market them to the patients and the people you want to come, but I would market that information to the people that are paying my revenue, my income, and say, here's why you should use us, and here's the results we're having. This is why we're good, and this is why you people won't have to come back again, and so forth. I think you should keep them happy. Insurance might be a bad word, or we might paint them as the bad guy off things. They take forever, or they don't pay, or they deny. I get that, but if they're a large part of your income, I would be marketing to them. And from my world, from an M&A world, right now, there's probably not a humongous premium put on the company that is monitoring results and paying attention to their outcomes. However, I can tell you that within a year or two, it's going to be a big deal. They're going to be probably another multiple or two for somebody that is having good results, and the insurance loves to deal with them, and it's all a good relationship. I think that's going to be a big driver and a disruptor in this industry within the next 1 to 3 years for sure.
That's great. What are everyone else's thoughts on how to use outcomes? So let's say that we are at least tracking them, as a third party or internally, but how do you guys see them being used effectively?
I'd probably jump in and just say, it kind of builds off of what Jacob was saying. One of the ways that we do use outcome today is when we are marketing the insurances, the reimbursement of what they will give you, they're a little bit more flexible and a little higher than what if you don't have any outcomes that you can provide. So one of it is definitely a financial component. That is kind of tried and true, but I think the other component is I don't think we're really good at messaging out to clients that might want to consider coming into treatment. That is a harder message to provide. So in one way, I think where we use it really, really well, it's not as effective, and I think it does come from lack of standards. That not everyone is measuring. Whenever you measure against yourself, you can always be successful.
Well, isn't that some of the fear, though? I mean, if I were to just randomly call 20 different treatment facilities and ask them, well, what kind of success, they're either going to dance around it, or they're going to give me some guesstimate number, or they're going to go with something that really isn't necessarily a true outcome. But part of that is because they know that that's what everybody else is doing. And so I think there's this fear of providing third-party information that is quantified and verified, because they're really, everybody's kind of just, they've assumed or they've stacked the deck in their favor just enough to be able to say, well, I'm not going to really tell you, how many people that came through our program last year are still sober, but I'll tell you that 97% of the people that came to our program completed the program. That's a very typical answer, which is kind of skirts a little bit of what the real outcomes are. But I think there's a fear, because if I'm honest about the treatment center that I'm at, about our outcomes that we've been tracking diligently, the assumption is nobody else is going to really be that honest. And so I don't dare really share with you everything that's true here, right?
It's a really good perspective. I think from the marketing perspective, I'm constantly advocating this idea that we need to be marketing outcomes, right? But like you said, really nobody's doing it. The only one I know of would be Recovery Boot Camp. If anyone wants to look up their website, they actually have their outcomes tracking that they got through Vista Research Group, and they posted it on their website for everybody to see. But as far as I know, they're also not marketing that. They've just put it up on the website and kind of left it. And I think there's a huge opportunity to push that education component into the community. And my curiosity is, I'm not quite convinced it'll have a huge impact on the consumer per se, unless there's a larger, broader education of what normative outcomes would look like, right? Because if you tell me that, your 30% success rate at a year sobriety doesn't sound great, right? But it might be great in terms of the field. But where I do see it being really valuable is from a business development perspective. So the clinicians and the other professionals that you're reaching out to do usually have a pretty good idea of what's normative and what's not. And so if you come and say, hey, look, we've got, our success rates are twice as high as the average center, that's really going to boost a referral relationship. I don't know if, Kathy, you might be able to comment on that part of it.
Yeah, so we do talk a lot about our outcomes with business development. We try to teach them because I think their role is to be trusted advisors, right? And if they don't understand what they're talking about, they won't be trusted. It won't add value. So, but I do think it still comes down to the fact that you can say that you're successful outcomes, but you really can sway the way you're saying it. So I think it's really important to share a lot more details with that. So with my business development team, I often have them use like a document they can share, or get like Siobhan Morris, who does the research, out to talk to clinicians. It's much more powerful than when I just say what our success rate is. So again, I think it's all about the messaging. And since I think about marketing every day, I think, well, how do I get that message across to build the trust, going back to the very first statement?
So I'm going to jump on.
Sure.
I want to jump on that really quick because, if anyone listens to me talk, I constantly talk about trust, and that's the foundation of marketing. It's the foundation of business. And so we get that with centers, right? Let's say a center comes to me and they say, okay, well, we have a 97% success rate in people completing the program. No one's going to believe that, frankly, right? I mean, it's addiction. It's like going to you and saying, hey, you know what? I've got this little 7-step system where you can go from 0 to 6 figures a year and then scale to $1 million, and in 2 years you'll be a millionaire. I mean, no one believes that. It's stupid, right? And so, like what you were saying, Kathy, in the beginning, when people see things that are unrealistic, it actually degrades trust rather than builds it. And so there's a lot of value in being honest and transparent. 1 second there. So there's a lot of value with being honest and transparent, because that's actually going to build the trust if you're showing real numbers, because I'm more likely to actually at least believe you than the guy that I call after that says they have a 100% success rate.
Right. Nobody's ever relapsed from our study.
Right. I mean, so I already know you're BSing, so I'm leaving. I mean, that's why marketing is such a problem and sales is always such an issue, because people don't trust them, right? Bad marketers and bad salespeople think it's about a technique or about telling you the right thing to get you to take the next step, right? They don't understand that's not the technique, it's the process of building trust, and you have to do that real authentically for it to actually be effective.
The good part of this whole conversation, this whole topic from an altruistic standpoint, is I think the whole goal of changing the stigma of addiction from bad decisions into a disease, et cetera. I mean, is celebrating recovery and everybody, the people that next door, and yourself and your family and everything. Is the same with, like James was talking earlier about not having people engaged if they're not responding to a survey for a net promoter score. Well, if we're tracking obviously the results while they're still in treatment, and then as they're out, you're continuing to build a community, alumni, et cetera, where you're staying connected to these people. You really want to help them. You're not just worried about, well, I've already done the service, so I've already gotten the fee. No, I'm actually concerned with their lifelong well-being. It's going to be much easier to, 1, get those results and track the outcomes, and 2, destigmatize the whole problem with the industry in the first place. I mean, I think the two go hand in hand, which is great from a mission standpoint. Okay, from my standpoint. From M&A, it's very, very, I mean, of course it's going to be helpful, but it's going to make the standards much more difficult. Multiples higher for those that do provide and do it correctly, and lower for those that are not participating. But I think it's a great step in the right direction for us to be tracking the results of what you're doing. I think everybody wants to do good, but are they really giving it their best? Maybe, maybe not. I'm not here to judge it. My point is it's better for business and better for the patient for everything to be tracked.
I agree. Well, I know we got to wrap up here. James, did you want to add some final thoughts before we sign off?
Well, Nick, you know me and Kathy, we've had conversations about this idea of it's all about trust, and we've got to look at it from a 360 point of view. We've got to look at it from the way that we're marketing online, how we're expressing that on phone calls, how that experience is throughout. I mean, I look again, looking outside of our industry to other industries, look at the hospitality industry and look at when they look at that experience, it is from A to Z, and then it goes on from there. And I think the more that we can look at how we're building trust, and to me, it goes back to empathy and compassion. Like, if you really cared for the person, it would not be a problem to check in with them 6 months after they have left treatment, because you absolutely care, right? You're interested in that. And what happens is we want to celebrate those who've had success after 6 months, a year, and so we get behind them. But we need to be doing that across the board every day. We got to show up from a place of absolutely caring for people. And that will drive, I think, a lot of the problems out of there is we're going to be more interested in tracking outcomes because we want to get better at what we do. And that's the only way I think that you can do that is you've got to see, where were we yesterday and where are we today?
Agreed. Well, everyone, thank you guys for joining. I appreciate it. For the listeners out there, if you want to subscribe to our YouTube channel, we'd appreciate it. We'll be releasing bi-weekly trending news. And with that, we'll see everyone next time.